Hey everyone, this is Dr. Brar here at Doctor for Moms, and today we're going to talk about some signs and symptoms to look for if your child has a hit to the head or a bad fall. So in other words, we're going to look for signs of a concussion. So in babies, it's really hard to tell if they have a concussion because they can't really communicate their symptoms to you, so it's up to us to be looking very closely for these signs and symptoms, and they can be very hard to find sometimes. So a few of them would be any changes in nursing or feeding habits, out of control crying so they can't be consoled, losing interest in activities they used to love doing before or their favorite toys even, and also losing new skills, so new skills they've learned such as toilet training. So when they get older, it's a little bit easier because they're now able to communicate the symptoms to you. And in older kids, some symptoms to look for would be headaches, any sign of nausea or sickness, any balance problems, so if they're walking to one side, so in toddlers especially if they're running and walking and you're noticing that they're tripping more than usual, any light sensitivity or noise sensitivity, if they're at an age where they go to school, if they're having trouble concentrating in school or doing their homework when they're getting home, if they're feeling sad or depressed, and once again, same thing as in babies, any changes in sleeping patterns. So if they're really hard to wake up from their sleep or they're really having a hard time going to sleep, these would all be signs and symptoms of a concussion. Now these are just the basic ones, there's definitely much more. And if your child has any of these signs or symptoms, bring them in and we'll take a look at them for you. And I will come up with a treatment plan if there is a concussion.